Great Day Live on WHES 11 is sponsored by Louisville CyberKnife, a service of James Graham Brown Cancer Center.
We'll say CyberKnife on Halloween. You're picturing some light-up saber that your kids will take trick-or-treating.
But in reality, Louisville CyberKnife is technology revolutionizing the way doctors are now treating tumors. Dr. Shiao Woo is medical director at Louisville CyberKnife. Thank you so much for joining us.
Thank you.
This has been around for about how long?
For about a year.
So it is relatively new. Tell us how it works.
CyberKnife is actually a precision radiation treatment machine for cancer. It is precision because of two unique components. One, interesting enough, it's good for Halloween, is a robot. The machine is actually a big robot that moves around.
And we're showing it here, kind of how it does move around.
Yes, the patient. The other is a system in the treatment room that tracks where the tumor in the patient is, so that the robot can seek it out to precisely hit the radiation beam to the tumor.
So since it is so precise, I imagine that you're able to treat tumors that are especially difficult to do so, right? In very tricky places? Correct.
We could treat tumor at tricky places where there are normal tissues, organs that you want to protect. Because of its precision, we can deliver larger, more powerful doses of radiation per treatment to the tumor because we harm so little of the normal tissue. So in that case, we make the number of treatments a lot less than conventional radiation. For example, for prostate cancer, generally, if you go anywhere for radiation treatment, it might require up to 8 weeks on Monday through Friday, daily basis of trip. CyberKnife can do it in 5.
Wow, and that's a big deal for patients who are undergoing that.
It saves a lot of time and convenience. Not only that, if you look at Medicare payment, it saves about 30% of the cost.
So cost and how many treatments. If there's a patient out there going, boy, I wonder if CyberKnife is something that I can use, what kind of patient are you looking for? A complicated tumor normally, you said?
Yeah, there are certain tumors that are particularly useful for CyberKnife. I mentioned prostate cancer, but many brain tumors, spine tumors, now, and early stage lung cancer. And that is another area that has had a lot of advances. I know many people with lung cancer. It's a big deal in Kentucky. They have bad lung function. So it is not suitable for surgery. Now, surgery is still the gold standard of treatment for early stage lung cancer. But if you can't go through the anesthesia, what are you going to do?
Right.
But now, with certain radiation treatment, especially with CyberKnife, you can get 3 to 4 treatments as outpatient. Nobody cutting on anything. There's no pain, nothing. And we have equivalent cure rate as surgery.
Now that's interesting.
Yes.
Yeah, and what does the patient need to be prepared for? Are there side effects? How do you feel when you're going through this procedure?
You just lay there and relax. We play music for them so that they kind of relax, you know. It takes sometimes 30 minutes to an hour, but most of the time it is about 30, 40 minutes or so. You just lay there. There's no sensation. There's no pain. There is no strapping you down because the system can track where to go, and the robot follows
we saw
very
those
precisely.
Pictures.
Yes.
Well, amazing. If somebody is out there, we want to let them know this may be a possible option. Hasn't been around for long. Louisville CyberKnife, again, is at James Graham Brown Cancer Center.
Yeah, and you can reach them at 217-8200 or at LouisvilleCK.com.